and your name, sir?
My name's Alan Warrington. I'm the Region 5 Vice President from the Ontario Nurses Association. So Region 5 is actually Southwestern Ontario, which Windsor is included in that.
So I know over the weekend with Southwestern Ontario, especially out in Wingham, some of those other places, we see ER closures. Talk about the state of our hospitals in this area.
Yeah, so I mean, obviously, Southwestern Ontario is no different than any area throughout the province. We've seen massive closures. We've got lots and lots of staff that are leaving the profession, but unprecedented ER closures. And as you said, just in Wingham, but Chesley, not having access to emergency health services is paramount for our communities. And as you can see, why people are out here is to raise awareness for the public. Sometimes the public isn't aware until they try to access the system. And that's what you see these protests across the province, is to raise awareness about a healthcare system that's in absolute crisis and a government that's in total denial about that crisis.
How much have you seen the healthcare system, I guess, deteriorate over the last several years?
Well, I'm a frontline intensive care nurse from London Health Sciences, and yeah, I mean, the pandemic only exacerbated what was already a problem for many, many years. It's just compounded the problem, and the fact that we have a government that won't acknowledge that there's a problem, the erosion of services, and basically an attack and an affront to our publicly funded healthcare system, it just has to stop. We can't take and privatize a system that doesn't have the health human resources right now. We have solutions. We need a government that stands with us to preserve and enhance the publicly funded healthcare system that we all deserve in this country and especially in this province.
And you currently working as a nurse, can you tell us a little bit about how much added stress you have, how much the workload has changed for you?
Well, I see, I myself was diagnosed with post-traumatic stress disorder, and I'm no different. There's many, many healthcare workers, registered nurses throughout that are in the battlefront right now that are suffering from mental illness, and there isn't enough services out there. So the lack of resources, having to basically take on additional care with no resources, is facilitating an environment that's ripe for psychological and physical breakdown, and we're seeing that everywhere. That's why people are leaving the profession. Devalued. Bill 124 basically did nothing to show any support for this healthcare workforce. Our members and the general public has to understand that at this time, we cannot have a government. It's an unconstitutional bill, and it's a first start to showing that the system and the workers are valued by basically stopping this ridiculous attempt to appeal this bill. Accept what the courts and the justice system have done, and let's start working together to rebuild a system that everybody deserves access, and let's work on the backlog. But we have to value our healthcare workers, and basically if we don't get to that, the system is in absolute peril. And offering private two-tiered system of healthcare is not going to actually do anything but exacerbate the problem.
Now, I did want to ask you this. I know it might be a controversial topic. I know over the weekend, South Bruce, the hospital there, mentioned they might be considering hiring unvaccinated nurses, doctors to address the staffing shortage. Is that something your organization has talked about at all? Is that something that nurses are talking about?
So, I mean, our organization, we've always supported the personal choice. We support vaccinations, but there are other measures in place where nurses and healthcare professionals can come to work. In fact, many of our members who are unvaccinated, they were working on the front lines with us, and so we've always supported. There are other methodologies to increase the healthcare workforce, and many of those people that some of these organizations are talking about, they were there, so they can have day-to-day testing. So we've always supported a vaccine. That'll never change, but we also support, the member and the general public's ability to make choices, personal healthcare choices. But obviously, we understand that in order to combat, the pandemic, obviously there's a multi-pronged approach. So obviously, organizations will make decisions that help their situations. But we obviously We need as many frontline nurses and healthcare professionals to basically stay in the profession, and we need to recruit and build up our system as well.
Anything else that you'd like to say?
Yeah, I just, like I said, I want to thank, the people of Ontario. Get out there, contact your MPPs. Obviously, the Ontario Nurses Association, we're here to support on the front lines, and we're here today to support for a publicly delivered healthcare system. No privatization, and message to the Premier and the Health Minister, don't appeal this bill.
And just one more question. How do I spell your name?
Yeah, it's ALAN. Last name is Warrington, WARRING.
Thanks so much.
Thank you.